we help individuals understand what it means to establish a speak up culture. And erroneously, many leaders have told me that they have heard that it's about fear of being fired. And interestingly, I don't find that.
Welcome to Safe Space Made Simple, a practical podcast that guides clinical leaders and healthcare managers to create trust and support with their teams. I'm your host, Trace Hobson. Join me for weekly interviews, practical tools, and inspiring transformational stories of bringing people together in healthcare. Now, let's dive in. Hey, everybody, welcome to Safe Space Made Simple. Have you ever had somebody that you were working with that you found incredibly difficult to deal with? Or maybe you've had a boss that you reported to that you found toxic and also incredibly hard to be around. Or maybe you're in a system that seems to foster these kinds of interactions because they don't actually deal with them in a way that is going to move the needle. In today's episode, I'm really excited to have Dr. Mitch Kusy with me today, who specializes in dealing with these kinds of behaviors. He's a best-selling author and has written several books on this topic. His latest couple of books are Toxic Workplace and also Why Don't I Work Here Anymore? I found this conversation to be relevant and practically applied, and Dr. Kusy is incredibly generous with the information that he has and shares with the world. I trust that this episode is going to serve you powerfully. And so without further ado, let's get right into the show. Mitch, thank you so much for being with me on the podcast today. I'm really excited to talk to you. Just to give our listeners a bit of overview of your work and who you are, could you share a little bit about your work in the world and maybe what you're working on right now that's really got you excited?
I'm a full professor in the PhD program at Antioch University. I've been there for 17 years. I'm also a consultant with the Healthy Workforce Institute, which has as its mission to eradicate bullying and incivility in organizations. So I'm one of the consultants there. I've also done a fair amount of writing, as you know. My latest book is called Why I Don't Work Here Anymore. And that should give you a cue about some of the research that's been done, including my own, about what happens when people are working in toxic systems, and many of them quit, or they quit and still stay on the job. I've also written other books, Toxic Workplace, Breaking the Code of Silence, about mistakes leaders make and how they recover from those mistakes. So a series of books. And I've been consulting for about 40 years now. So It really makes me feel old saying that, Trace.
You look great for your age. Don't even kid yourself, Mitch. You look great.
Thank you. I hide it well. So that's a little bit about my background. I'm an organizational psychologist, which means my specialty is helping organizations figure out what they need to do to change the culture of their organization or their teams. So that's it in a nutshell.
Yeah, thank you so much for being here. Your work is deep and broad. And like I was telling you before we started recording, I feel like we're going to need to have you come on the show more than once to get a few things covered. And I love that you're a consultant for the Healthy Workforce Institute. That's Renee Thompson's work, of course, and her podcast, which is Coffee Break. I've heard you on there as well. Love Renee's work, and I love the work that you're both doing together. So it really gives me a lot of hope for our healthcare system in Canada that you're working down south. And who knows, maybe we'll do some work together at some point.
I would be delighted.
Yeah. As you look at the lay of the land let's talk about healthcare specifically, because the teams that are listening to this podcast are clinical leaders, healthcare managers, and executives that are trying to navigate legislature that is related to bullying, harassment, discrimination, and discriminatory harassment. And we have tons of different processes inside of organizations to help leaders to deal with that. And yet this phenomenon continues to happen. And it does, like the processes, the standard operating procedures, they don't seem to help those leaders with really difficult people that are on their teams. And because of collective bargaining agreements, they can be inside that team for a long period of time. They're really difficult at times to sort of help or support or to see leave the organization. So I'm curious, what is your experience with that? And what kinds of things do healthcare leaders and managers need to do to address these issues in a complex system like healthcare?
Gosh, that's a big question.
Sure it is.
Let's break this down. And the first thing that I believe, and this is also what the Healthy Workforce Institute believes, is awareness is one of the first interventions. And awareness, and I look at this from two perspectives. Awareness in terms of an assessment of what's going on in the organization, pockets in the organization or pockets of teams that may be demonstrating bullying, incivility, shaming behaviors. So that's within an organization. One of the awareness pieces that many consulting firms forget to look at is the research that's been done already that we know what a havoc this creates in healthcare. For example, in one study that was done with 13,653 patients,
Hmm.
one of the things that they found was that those surgeons who had more coworker complaints about their behaviors were significantly more likely to have an increase in surgical medical complications.
Hmm.
And at the probability rate of 0.001 in terms of statistical difference between those surgeons who had complaints and those surgeons who did not. So essentially, what that research indicates, surgeons ought to look at their behaviors in terms of what they're doing related to their disruptive behaviors and the potential of complications. Often, we don't think of our behavior in healthcare in terms of medical complications. Now, I don't want to demonize physicians. This happens across the board.
Right.
In another study of nurses in 20 hospitals, they discovered that with more incivility among nurses, there was a higher medication error rate,
Hmm.
significantly higher. So back to your first question to me, awareness, what's going on within the organization in terms of disruptive behaviors, and then awareness of it's not about being nice.
Hmm.
Sometimes we have to give hard, critical feedback. One of the lines of demarcation that I share with my clients is this. When you're giving feedback about someone's behavior, are you giving feedback to prove you're right?
Hmm.
Or are you giving feedback to change behavior?
Hmm.
If you're giving feedback to prove you're right, stop it. So again, I'm not here to demonize any one group. I can go through the whole litany of various professionals, and what we know is the
Right.
way we treat each other impacts the patient experience and impacts patient safety.
Wow. So when you look at awareness, Mitch, what I'm curious about is looking at a person who is acting out in a way that would be considered toxic or incivil, disrespectful. What are some of the things you found in your work that tells us why that's happening? Because to your point, I think if we understand and have awareness, we might be able to support that person to do something different. And at the end of the day, we're all human beings walking along through this journey
Right.
together. So I wonder what kinds of things we can do shoulder to shoulder with that person to help them to change.
Those are two different questions. The first question you asked is why is it happening? Second is what we can do.
Sure.
I would say you shouldn't be focused on why it's happening. Let me give an example that's not related to disruptive behaviors. If you perceive someone uh, is coming to work and they have alcohol on their breath, one of the things is you don't say, you know what, I think you're an alcoholic. That's That's a why. That's a diagnosis that we cannot make. What you can do is call them on their behavior. People have noticed that you've been erratic at meetings and you've raised your voice. Here are some times that that has happened. You've been coming late to meetings and people have smelled alcohol on your breath. You can say those things. So what we cannot do is be a diagnostician. I never help a client system understand why it's happening in terms of with an individual. What we need to know is these are the expectations and this is what needs to occur. However, the why does come into effect in this way, not about the person, but the organizational system. Why are leaders allowing people to get away with bad behavior? That's a why question that I help leaders explore.
Mm-hmm. So let's double click on that a little bit, because I think you've taken us to the right area in what I was kind of leaning into, which is the systemic implications of why this might be happening.
Yes,
Because I know
exactly.
in Canadian system, in the healthcare system, one of the things we notice from labor shortages, from lack of people, from the incredible demand on the system and the lack of resources to be able to meet that demand, that's creating all kinds of systemic distress. And that's a scalable phenomenon. It's happening for individuals, for teams, for whole organizations and units. So and people respond to that level of stress in different ways. Some people will go inside. Some people will become, disrespectful. Some people will go home and watch Netflix and eat ice cream and drink. Some people will do all kinds, different people do different things. So I wonder, as we're looking at the system, what kinds of things have you learned will help that system to become aware and help the leadership to become aware? And then what can we do to support something that's more resourceful for those folks that are in that system trying to navigate it?
Well, one of the most effective strategies is to do an objective assessment of what's going on in the organization.
Right.
And that objective assessment for me, and this is the way I have done this with the Healthy Workforce Institute, is first of all to collect baseline data on
Right.
what's going on. Where are those pockets that people are saying people are getting away with bad behavior? So doing an assessment. The assessment consists of a pre-post survey, and then 6 months later, post to see if the intervention helped, and then there are subsequent surveys after that. So collecting hard data, quantitative data, collecting qualitative data. And for me, that means conducting individual interviews of key stakeholders. And what's really important is conducting focus groups and finding out where are those pockets that people are having these issues. And it is really interesting, Trace. People will say things to me that they haven't said to other leaders. I don't know, maybe because I'm creating a safe space. And probably because what I say to them in the interviews and the focus groups is I'm looking for themes. Just
Mm.
because one individual or one group says this doesn't make it a theme. So I'm looking for themes where a number of people to corroborate. And the reason that themes are important is that while there could be so many things that an organization needs to focus on, find one or two pockets to start addressing this, helping leaders understand what they can do, helping staff understand what they can do. So the most important piece is first to get a level playing field of where people are at.
Mm. Mm. So when you have that baseline and then you start to work, and what kinds of case stories or experiences can you share that has helped to move the needle on that particular case? And then what did you discover as a result of doing your work with them?
Right. It depends on each client system, but some of the interventions include such things as individual or group coaching. Group coaching of leaders is extremely powerful. as well as individual coaching. But the wonderful thing that I really appreciate about group coaching is that people bring their experiences and bounce them off each other, and it's a peer-to-peer mentoring learning kind of process.
Mm-hmm.
So that's one system. Another is teaching individuals how to recognize bullying and incivility and what to do about it. So one of the recognition systems that we talk about in the Healthy Workforce Institute are 3 lines of demarcation, if you will. The behavior is targeted, it's harmful, and it's repeated. So targeted to an individual or a group, and the literature and the research identifies targeting this behavior to a group it's often called mobbing. So targeted, it's harmful. Whether or not we, as the perpetrator, think it's harmful doesn't matter. It's
Right.
what that person who's the target of that, the victim perceives. So targeted, harmful, and it's repeated over time. So it could be something that's targeted and harmful, but it just happened once. It could be, you know what? I got up on the wrong side of the bed and I didn't treat someone very well. And then in those circumstances, one of the things that I teach is a strategy that I call the 4-step apology. I'm not going to go into that now because that's maybe for another session. So
Sure.
one is coaching, one is leadership coaching, individual or group. Another is teaching people some of the perspectives on how indeed how to recognize bullying and civility, how to differentiate that from someone just having a bad day, and then what to do about it in terms of providing feedback. Another large system, and this is sort of later in the game. Usually this process is about a 6 to 9 month process, and about halfway through, we develop what's called a compact of professional behaviors. And we bring the entire team together. So it could be 50, 75, 100 individuals in a department. And they, through a series of post-it notes, stickies, if you will, they identify one behavior per sticky note that they always want to see and experience and never want to see or experience. And I, during this 45-minute period that they're engaging this activity, I say quantity is everything. So you could have one behavior and you could have 55 post-it notes that you're putting on you always want to experience or witness and never. And as you know, in healthcare, everyone can't be there at one point in time because someone's got to take care of patients.
Right.
So at the end of this 45 minutes, you might have 10 flip chart pages with 600 post-it notes, always and never. And that travels for one more week and goes to the team, and team members who couldn't be there contribute more, and those who were there can contribute. And then ultimately what we do is we develop themes. And out of those themes, I develop a 1-page compact of professional behaviors of what we always want to experience and what we never want to experience. 1 page, no more. And the amazing thing, when people see this, they say, that's right on. You just held a mirror up for us. And it becomes a new mantra. And all other interventions from then on focus on this as your new mission of the team. It's extremely powerful. One of the most powerful things that we do.
Yeah, amazing. Thank you for sharing that. Hey, just a quick pause to today's podcast. Are you having a challenge as a clinical leader with one or more individuals who you find activate you on your team? Or maybe you're noticing that oftentimes you want to be able to communicate with people, but in the heat of the moment, it's difficult for you because you're having a difficult time regulating yourself. Well, I totally understand this. This has been some of the biggest challenges in my life as a leader and as a human being. And so I created a free resource for clinical leaders, nurse educators, and healthcare executives called the Relationship Regulator. It's a mini course that will show you step by step a framework that may serve you very powerfully in this area. So if you want to download the relationship regulator for free, click in the show notes and you'll find that resource for you today. Now, back to the show. This kind of leads into another part of a question I've got for you that this podcast attempts to answer from different perspectives over and over. And that is, how do you create a safe space? And what is a safe space? And of course, you've got psychological health and safety. And in Canada, we've got the Canadian Standard of Psychological Health and Safety. We've got 13 psychosocial factors that are tracked by that. But then you have this idea of neurobiological safety, or what Stephen Porges talks about as sort of a bottom up polyvagal safety. And so I'm curious, when you are doing your work, what's a safe space mean to you, and what kinds of things do you do to create that with people? And you alluded to that earlier in your interviews, but what are you actually doing in those types of settings?
One of the things that we have done is helping individuals, teams, and leaders understand what it means to establish a speak up culture.
Mm-hmm.
That what's fascinating is when I interview staff members, nurses, physicians, pharmacists, maintenance people, one of the things is they're not fearful of losing their job if they speak up. Because often people think, oh, I bet people think they're going to lose their job. No, I don't typically hear I'm going to lose my job. What I hear is when I speak up, this person may roll their eyes at me. Or when I speak up, this person afterwards, I hear that they gossiped about what I just said. So subsequently, we help individuals understand what it means to establish a speak up culture. And erroneously, many leaders have told me that they have heard that it's about fear of being fired. And interestingly, I don't find that. I'm not saying it's not there. Some people may have that fear. It's more about the passive aggressive things that people are worried about. I'll be shamed in public if I say this. My ideas won't be valued and someone will speak down to me. And so when that happens, just think about any of us. If that happens to us, we shut down.
Mm-hmm. So what is your antidote for that if you're in a setting where, let's say, that the manager or the leader is somebody who is a high performer, they're doing really well in terms of numbers and metrics, but the culture of their team is not doing well from the perspective that you just described, where people are feeling like it's okay to share, it's okay to, talk about what's going on. And then, that leader has allowed sort of a culture of disrespect to continue to develop, where there is gossip and there is bullying and harassment. When you come into a situation like that, what are some of the things that you do to create a safe space for that kind of a complex problem?
First of all, back to how we started today, is to create an awareness that, are you aware when these things occur, this is what's going on in your team? For example, in my book, Why I Don't Work Here Anymore, I talk about the chameleon effect, where individuals who are toxic, targeted, harmful, and repeated, individuals who are toxic. The chameleon effect is this: someone kisses up to their boss, and this same person kicks down to people below them on the hierarchical ladder. All right, so if you've got that situation, this person in the middle kissing up to this individual here, knocking down here, and if this person down here goes to this leader and says, are you aware of what's happening? There's a tendency, this is the chameleon effect, there's a tendency for this person to say, I know this person in the middle, a little tough, but look, just what you said, look at the results that they're getting. But what they don't see is the turmoil, or they don't see individuals who are leaving as a result of talking to that individual. Speaking of which, okay, you've got the person here, the person in the middle. The person in the middle is the toxic, um, uh, talking down, highly disruptive for this individual. This person here say, look at the results they're getting. Then someone says, well, you know what? These people shouldn't have been here anyway. And so during the exit interviews, the person is being interviewed by an HR person, this person that has been, if you will, victimized, doesn't tell the truth. I've discovered this in my research. So the HR person, all goodness and quality of what they're doing, they say, tell me about your experiences working here. And this individual says, well, you know, I've had a great experience. I've been here for 12 years. I've learned a lot. Can you tell me why why you're leaving? By the way, I said because this happened to me 30 years ago. Um, Tell me why you're leaving. Oh, I'm looking for another opportunity. I want to advance more, and those advancements aren't available here. You want to know what the backstory is? The backstory is this person had this bad boss, and they don't want to tell the truth because they don't want anything to happen in their new search, their new job that they've just found in another organization. And so one of the strategies that I teach, system strategies, is to conduct the exit interview 3 months or so after the individual has left.
Right. Yeah.
And you
Right.
say to them, you know what, typically exit interviews would be conducted this week. What I want to do is hold off. And if you're willing, may I contact you in 3 months to talk with you about your experiences, and you'll get more truth there. So, first of all, when you said what are some of the things you can do, is awareness is one of the first steps. Secondly, one of the things I teach is if you're in this situation with the chameleon effect, individuals who kiss up but they knock down, you can go to that person at the top, and there's a greater opportunity for success if someone goes to that individual, if others are having the same experience rather than going alone.
Right.
So one of the things I say in my book is don't go it alone. So I literally have dozens of strategies, some system strategies at the organizational level, like the exit interview. I have a system strategy for how to reduce the probability of hiring a toxic individual at the system level. I have team strategies and one-on-one strategies. So I just had given you a few of them here right now.
Yeah, that's amazing. I was laughing because that's been the experience that I've seen in exit interviews in Canada over and over again, is we don't get the right information. And so you're nailing it. And I think that is a huge issue, because my background wasn't healthcare. I've been working in healthcare now for about 8 years. Before that, I was working in industry, and this kind of thing doesn't really last in the sector that I come from, because everything's sped up. Things happen much more quickly. But to your point, when you don't get a good exit interview, this toxicity can last for, in some cases, years and years. And I found that amazing as I kind of broke into healthcare. I was like, why is this going on for so long? And people are suffering needlessly. Like it's really.
Well, it's interesting that you say this. And notice when you were talking to me, I slipped and I said I. And because this happened to me 30 plus years ago in a position where I had a toxic boss. And during the exit interview, I lied. And why? Because I was fearful that this toxic boss could say something, might know someone in my new place of employment and badmouth me. So I made up this excuse about I wanted other opportunities. Lie. And I wouldn't have done that if at the time I was told we want to contact you in 3 months. Then I've settled into a new position people understand that I can be successful. So I would have told the truth.
Yeah, this is amazing. I think of also my parents are aged now, and my wife and I are living with them on the same property. We care for them, and we were just talking with my mom and my dad about this yesterday or the day before. It's a bit of a flip, but it's a variation on what you're talking about because she worked in a school board, and she was during the interview they quizzed her on what her ability to deal with toxic employees was, and she thought that was a little strange, but she answered, she got the job, and then immediately got into a reporting situation with a boss that was incredibly toxic, a bully, harassed her. She thought, well, what am I going to do? This was the first time this was the last job that she had before she completely retired, and she went to the leadership because she thought that was the right thing to do, and ended up leaving, and they didn't do anything yet. We know they actually were interviewing people based on their ability to deal with a toxic boss, because the toxic boss had been there for so long, and I guess was valuable enough that they didn't want to change that, or they, for whatever reason, couldn't let that person go. So it's incredible to me that that continues to go on, and how large the problem is, in education, healthcare, and in social services here in Canada. We notice this all the time. So you got your work cut out for you, Mitch. You've got
I
a
do. It's interesting when you're just talking about how pervasive it is. I did with my colleague, Dr. Elizabeth Holloway, a 3-year study on toxic behaviors in organizations, and we gave an 82-item online survey of the top behaviors that we discovered in our focus groups, and we asked them about this. And one amazing statistic was this, that 94% of 900 plus leaders in our study said in the past 5 years they've had to deal with toxic work systems. 94%. We also discovered, and this is the reason my book is called Why I Don't Work Here Anymore, 51% of individuals, the 900 plus leaders in our study, said they would be likely to quit. And other researchers, two that I can think of at this point is Pearson and Porath, and they wrote the book, The Cost of Bad Behavior, and they did a great study, and they found 12% actually do quit who are in those systems.
Yeah.
Also, what's interesting is we've been talking about reactive strategies. What do you do if you're in this? And I said, I have dozens and dozens of strategies that we use, and we have a basic 4-phase model with the Healthy Workforce Institute. We also have a whole series of proactive strategies. What are the kinds of things that you need to do to avoid bringing a toxic person into the work system? And as an organizational psychologist, there's no foolproof system. Human behavior is about probability, increasing or decreasing the probability of something occurring. And I have a very detailed chapter on this in my book, Why I Don't Work Here Anymore. And what this is I call it the recruiting cue sheet. And let me give you a little scenario that's it's based on reality, but I'm going to change the names to protect the innocent. So a VP is being interviewed for this position in healthcare, and she's flying from Boston to LA for the interview, a 2-day interview, series of interviews with various team members. And her name, I'm going to make up her name, Sarah. Sarah is flying in, and she's supposed to meet the hiring manager that I will call Dave at the airport. But Dave, the hiring manager, was running late, so he sent his personal assistant, Tim, to meet Sarah at the airport. So Tim is at baggage claim, then meets Sarah and says, Sarah, how was your flight? It was a great flight. Thank you, Tim. And Tim says, well, as you know, we've changed some of the itinerary. Would you like me to share that with you? No, I'll wait until Dave gets here. Red flag 1. And Tim said, maybe she's just a little nervous. So Tim says, well, at the evening interview, you were going to do a presentation here. And now we've nixed that presentation and we have someone else that's going to be talking with you. Would you like me to share a little bit more about him? No, I think I'll just wait on that. Red flag 2. So what ends up happening is Dave, the hiring manager, shows up 10 minutes later, and all of a sudden, Sarah is absolutely ebullient, effervescent, and says, Tim just gave me some great information on what's happening with the changes. And no worries, I'd like to hear more about this from you. And Dave is thinking, boy, this Sarah walks on water already. And Tim is saying, what just happened?
Right.
Well, I'm not going to say that Sarah's toxic, but you have the possibility of hiring a toxic individual. So in my book, I talk about what I call the recruiting cue sheet. Most of these high-level interviews, as well as clinical interviews, they're all team-oriented, fabulous. But there are certain individuals who are likely to interact with that candidate who are not part of the interviewing team.
Mhm.
I want to talk to those people.
For
So on
sure.
the recruiting cue sheet, I have something like the person looked like someone that they talked about, or they exemplified our value of XYZ. The person engaged me in conversation. And you could create that recruiting cue sheet, and you go to these individuals ahead of time, not afterwards. And you say, you may or may not have an opportunity to interview, pardon me, you may or may not have an opportunity to interact with this person. But if you do, would you just jot down some responses to these 2 or 3 questions? And I'm going to come back and collect results. And these could be maintenance people, clerical people, cafeteria people, drivers, etc. You will discover some amazing information. And if you discover something that's negative, it doesn't mean that you don't hire them. What it means, it's something I need to probably follow up on.
Right. Right. That's an amazing approach. I love that you're including all the stakeholders that are going to come into contact. If you had to boil down the essence of what that reveals, like what is the characteristic that you're looking to measure in that whole process? What would it be?
The primary thing is this individual only going to give credence to those individuals that they perceive have power?
Right. Yeah.
That's what you're trying to discover.
I
Remember
love this
back to
approach.
15 minutes ago, kiss up, knock down.
Right.
Well, individuals that love power are going to kiss up to people with power. They're going to knock down to people that they perceive don't have power. You've just got a toxic person in your system.
Whereas the opposite is also true. If you have somebody who understands that we're all human beings doing this together, it doesn't matter what your role might be. If you pick me up in a cab, or you're, my barista at Starbucks, or you're somebody who is guiding me to the meeting room, everybody has equal value intrinsically as a human
That's
being.
right. That's
I love
absolutely right.
this. What a great approach. So, Mitch, now we're just coming to the close, and I want to give you an opportunity. What kinds of things are you working on that you would like to share with the audience, and how can people get in touch with you?
Well, let's see. What are some of the things I'm working on? I'm working on with several client systems, doing continuing to do the full assessment. We call it the comprehensive assessment, and then intervening in various perspectives with the compacted professional behaviors, individual and group coaching. So I'm continuing with a vengeance with that. I also have my fabulous PhD students that I'm working with, which is an absolute joy. And I've just finished writing some new kinds of perspectives that may not come out immediately, but about some of the practical strategies that I've been engaging in with the Healthy Workforce Institute. So it's just been absolutely exciting. I'm on the keynote circuit. For example, I've got a keynote address that I'm delivering with the Association of Occupational Health Professionals in September with my colleague, who is a physician, Dr. Steve Wiesner. We're doing that together. And I guess that's one of the things I'm doing more and more of, partnering with other professionals rather than doing a lot of things solo.
Wow. Well, thank you so much for your time, Mitch, and thank you for the work that you're doing in the world. It's very
Thank you.
encouraging to hear
You ask
about
great
people like you.
questions.
Yeah, thank you. Thank you. I'm already looking forward to the next time you can come on and share more about your work as it emerges over the next couple of years.
Absolutely. It's interesting. One final thing, that the feedback that I get from my book, Why I Don't Work Here Anymore, the overall feedback is, I can't believe how practical it is, and how you're based these practical strategies on the evidence that you've collected or the evidence from others.
Yeah, thank you for that. Thank you so much for being here, Mitch.
You're welcome, Trace. It's an absolute delight. Thank you.
All right. Thank you so much for being here with me. And remember, if you could take a moment and leave a review or a rating on the podcast platform that you're listening to, that would be incredibly helpful for us to amplify the message that we're trying to get out there about transforming healthcare systems in a positive way. Thanks again for being here. And remember to be a safe space. Thank you again for getting to the end of this podcast. And if you enjoyed this and you found that there was value in it for you, my invitation is for you to subscribe for future episodes that come out weekly on Tuesdays. Thank you again, and I'm looking forward to being with you next time. Now remember to be a safe space.